Over the last few years, Americans have been bombarded with health advice.
There's no reason to be walking around with a mask.
Back in March 2020, Dr. Anthony Fauci, now the former director of the National Institute of Allergy and Infectious Diseases, said masks weren't needed days before the COVID-19 pandemic was declared. He reversed course shortly after and has admitted,
when it came to the implementation of public health, the uniformity of a response, the communication, the ability to get data in real time, we really fell very short.
Republican Senator Ron Johnson blasted Fauci earlier this month.
Nothing we did during COVID made sense whatsoever.
And a new global Edelman Trust Barometer survey shows trust in health institutions is declining. Fears about the politicization of medical science have increased, rising 13 percentage points in the past year to 64%. And according to Pew, more than a quarter of Americans now say they have not too much or no confidence in scientists to act in the public's best interests. That's up from just 12% in April 2020.
I am concerned that the next time there'll be less people tuning in.
Dr. Anand Parekh, chief medical advisor for the Bipartisan Policy Center, says communication needs to be improved.
I think we need to more clearly describe what we know and what we don't know.
And with many questioning mandates for masks, vaccines, and closures, former CDC Director Dr. Tom Frieden recently wrote, mandates must be rare, appropriate, nuanced to time and place, and led by local decision makers. Faced with identical epidemiologic data, two communities may decide differently about whether and when to close schools, businesses, and public gatherings and activities. That's appropriate. Frieden says empowering communities to make decisions about mandates is essential in rebuilding trust in public health. In Washington, I'm Janae Bowens.